regard to the Medicaid program, this pays out over the course of 6 years. And like I said, since Medicaid is a state-run program, we don't see the penalties reflected here. However, if that Medicaid provider also treats Medicare Part B on a physician fee schedule, they would be, and they're not doing meaningful use, they would be subject to the Medicare penalties for those patients. Now, the first year that we do Medicaid, it's adopt, implement, and upgrade, so I don't have to do meaningful use that year one, and that's the lion's share of the incentive funds that they get. They have to buy it, they have to upgrade, they have to be in the implementation queue. Then their second year of participation, that EP, would do 90 days of meaningful use followed by a full year thereafter. So the total is $63,750. But understand, eligibility is vetted every year. So I have to meet the volume threshold. I have to do the right things each and every year. So just because I met it this year doesn't necessarily mean I'm going to meet it next year. Now, with regard to Stage 2, like I said, it came out in the Federal Register on September 4th. One of the big things that it's done is it's pushed the timetable before they were going to launch Stage 2 in calendar year 2013. That date has now been pushed to 2014. They did push that 1 year to kind of align things. Testers in calendar year 2014, whether that provider is a Stage 1 meaningful use provider or a Stage 2 meaningful use provider, they would attest using quarters. They will not use a full year in calendar year 2014. So this is a pretty big deal. For Medicare, it's a 3-month reporting period that starts that year. The first year Medicaid EPs would always use the 90 days, or they could use quarters. That's going to be the state's option. So right now it's kind of this rolling 90 days. States can continue to do that, or they can move to the quarter outline like the federal government's doing. There's a reason that they're doing that. Everyone will always get 2 years in each stage. They have also changed the clinical quality measures that you will be expected to submit these electronically. So this is a pretty big deal. And then patient engagement, I can't tell you how big a theme this is. Please, please, please start developing your strategies for patient engagement. Stage 2 also will allow for batch or group reporting. This is again going to marry with this companion rule on what vendors like SuccessEHS will have to test and certify on, but they will have to do batch or group reporting. You will also be expected to move into production health information exchange. A lot of that is related to transitions of care and referrals and processes along those lines. So HIE is going to be very important moving forward.